Dr. David Mills, lecturer of public health at the School of Medicine and president of the PNG Society of Rural and Remote Health, said while a majority of the population in the country live in the rural areas, there is very little to sometimes non-existent access to basic health care, let alone a doctor.
Where missionaries set them up, but the missionaries, of course, are no longer coming, and so in many cases the hospitals are now empty.
The medical faculty and its partners are taking a two-pronged approach in encouraging doctors to consider a career in rural areas by trying to induce interest through their rural block courses in their undergraduate programs, whilst offering a specialist postgraduate program in rural medicine.
We realised that, first of all, we had to raise the awareness about rural health, raise the interest in rural health, incentives, etc., etc. But the second feature was that we really realised that you actually had to train doctors specifically for this task. And the reason we got those clues was because we were having young doctors like Raymond and others who were very passionate about rural health, wanting to go out and serve their people. And they would try and go to these places and they were totally overwhelmed with the experience.
Dr. Raymond Saulap is currently in his 6th year of specialist training in rural medicine and is based out of the Lutheran Health Service in Wapenamanda, Enga Province.
So this training is actually a multi-skilled specialist training, which is something the university talked through it since about 2005, and surely then after probably 2 years, that was when it started taking its full effect in terms of becoming like a training in the university. So it's nothing new, it's been there, and so here in PNG it's just the name, it's called the Master's Medicine in Rural and Remote Health and Medicine. Yeah.
The idea to place doctors in rural Papua New Guinea is not a new concept. In fact, the original healthcare plan for PNG envisioned and supported doctors to be trained and be based in districts where the majority of the country's population live. Sarah Aupong, National MTV News.